Hey guys, you see Arslan, media pharmacist here on YouTube. This week's video is on Gabapentin. We'll go over key facts about the medication, how and when to take it, side effects and how to cope with them, as well as some overall facts you should know of to becoming an informed consumer when it comes to your medicine. This channel is all about helping you make better and more informed decisions about your health and wellness. So if that's something you're into, be sure to smash that like button below now. It lets YouTube know that these videos are important and also helps get the message out there. Also, while you're at it, hit that subscribe button too to stay up to date with new weekly health and wellness videos. So without further ado, let's get straight into it. Gabapentin is an epilepsy medication in the class of medicine known as anticonvulsants, but it's so much more than that. It's primarily used to treat partial seizures and neuropathic pain, and it's a first-line medication for the treatment of neuropathic pain caused by diabetic neuropathy, nerve damage that can occur if you have diabetes. It's been used for postherpetic neuralgia when you get chronic pain after shingles, and central pain, but you also see it used for so many other uses as well, such as restless leg syndrome, non-neuropathic pain, anxiety, and bipolar disorder. Common brand names include Restless and Neurontin, which are the extended release versions of Gabapentin, starting off with 300 or 600 milligrams and are longer acting, requiring once or twice a day dosing, versus Neurontin, the more popular brand name, a version of Gabapentin that is immediate release, which comes in capsules of 100, 300, or 400 milligrams, or tablets of 600 and 800 milligrams, and as a liquid solution at 250 milligrams per 5 milliliters. The main difference comes down to how fast they work and for how long they end up staying in the body to do its job. It also comes down usually to how many times you end up taking it per day. Doses of the immediate release Gabapentin are usually given 3 times per day for seizures and postherpetic neuralgia, and is available in generic forms, whereas for the extended release version, it's common to take it as few as once a day, and currently at the time of filming the video, there's no generic form of Horizont or Gralise available as of yet. It was first approved in 1993, and in 2018, it was the 11th most commonly prescribed medication in the US, with more than 45 million prescriptions, which means there's a need to be educated on how to take Gabapentin safely and effectively. In terms of how Gabapentin works, scientists aren't entirely sure how it works exactly, but it appears to work by altering electrical activity in the brain at the specific site called alpha-2 delta site, located on the voltage-gated calcium channels. Doing so relieves nerve pain and lowers the risk of seizures by influencing the activity of chemicals called neurotransmitters, which send messages between nerve cells in our brain. Once they start to slow down, this lowers the excitement our neurons face, thereby controlling seizures as well as how we perceive pain. And it's usually one of those medicines that has to take time to build up in your body for it to work fully. It sometimes takes a few weeks for Gabapentin to work properly, so you may still have seizures or pain during this time, which doesn't mean that it doesn't work. It simply means it's not to its full working effects yet. Some things you should keep in mind is that Gabapentin is usually well tolerated, but there may be side effects that occur commonly as well that I'll get into. So definitely stay tuned for that, especially at the beginning of treatment. In an alarming report, it was noted that 1 in 5 opioid medication users may also be misusing and abusing Gabapentin. Gabapentin can be abused to boost the high a person gets from opioid painkillers like oxycodone, and muscle relaxants like Soma, and anxiety medications such as Valium or Xanax. And in 2019, the FDA issued an alert that serious breathing problems have been reported with Gabapentin and other related medicines like Lyrica or pregabalin in people at risk of slowed breathing. So if that's you or anyone you know, please have them get the help they need and contact your doctor if you see a concern. Take Gabapentin exactly as your doctor has told you to take it and follow the directions on the bottle, label, and packaging. If you're not sure, check with your doctor or pharmacist. This is the best way for the medicine to be beneficial in controlling seizures and pain, as been shown to do so, but it has to be taken correctly. So because Gabapentin is used for so many different indications, it's hard to say what directions you need to follow, but the golden rule is to follow the directions your doctor has prescribed you for the best results in your treatment. It's normal though at first for epilepsy to take 300 milligrams 3 times per day. Then your doctor may adjust your dose as needed and tolerated. However, the dose is usually not more than 2400 milligrams per day. As far as postherpetic neuralgia, Adults at first take 300 milligrams as a single dose in the evening. Then your doctor may adjust your dose as needed and tolerated. You could take gabapentin with or without food, but wait at least 2 hours after taking an antacid that contains either magnesium, calcium, or aluminum before taking your gabapentin dose. The interactions between the antacid and gabapentin may prevent proper absorption and it lowers its effectiveness, so please be mindful of this. Also, you should avoid or limit the use of alcohol while being treated with gabapentin. One more thing, you want to make sure you swallow the gabapentin capsules and tablets whole with a drink of water or juice. Do not chew them. Always check in with your doctor to make sure that you are taking them correctly. Can't stress that enough. Let's move on to the side effects and how to manage them. Probably what you guys are all here for anyway. Some common side effects that are usually mild and go away by themselves is feeling sleepy, tired or dizzy, nauseous, vomiting or diarrhea. Mood changes are another common one. Weight gain, as gabapentin can make you feel more hungry. Memory problems, especially with short-term memory. Dry mouth and difficulty to maintain erections. So let's address how to manage each of these and point you in the right direction. For feeling sleepy, tired or dizzy, as your body gets used to the gabapentin, these side effects should wear off. If they don't wear off within a week or two, your doctor may reduce your dose or increase it more slowly. If that doesn't work, you may need to switch to a different medicine. This is also why it's best to avoid alcohol, as it can make you even more drowsy. As for feeling nauseous, take gabapentin with it or after a meal or snack. It may also help if you don't eat rich or spicy foods. As for vomiting or diarrhea, drink plenty of water and other fluids to avoid dehydration. Do not take any other medicines to treat diarrhea or vomiting without speaking to a pharmacist or doctor. As far as mood changes, if you feel this medicine is causing mood changes, please talk to your doctor. You may be able to change to an alternative medicine. For the memory problems, you want to speak to your doctor as well. They may want to try a different medicine. As far as dry mouth, you can watch my video I made here on how to fix that. And as far as maintaining erections, you'll want to speak to your doctor again, as they may be able to change your medicine or offer other treatments that might help as well. As far as more serious side effects you should be aware of to let your doctor know are, like similar to other anticonvulsant medicines, gabapentin may increase the risk of depression and suicidal thoughts, particularly in young adults under the age of 24. If you, your child, or your caregiver notice any of these side effects, tell your doctor right away. It hurts to see most people never even bring this up to their doctor at all and go through this feeling alone. But feeling agitated, irritable, feeling sad or hopeless, getting upset easily, or feeling hostile are all real side effects, and it's no shame to bring these up to your doctor, so please have these conversations and remember you're not alone. Your doctor will check your progress at regular visits, especially in the first few months if you have epilepsy, to see if this medicine is working properly and to decide if you should continue to take it. This would be a good time to bring up any of those side effects. Also, another big one, check with your doctor right away if you have a fever, rash, swollen, painful, or tender lymph glands in the neck, armpit, or groin, unusual bleeding or bruising, or yellow eyes or skin. Gabapentin may also cause vision changes, clumsiness, sleepiness, or troubled thinking. Make sure you know how you react to this medicine before you drive, use machines, or do anything else that could be dangerous if you're not alert. If these side effects are especially bothersome, check with your doctor too in that case as well. The best practices when it comes to gabapentin is being comfortable with your doctor to bring up anything that you feel is necessary when you're on this medication. As with any other medication, gabapentin has interactions that you should know of as well that I've left in the description below for you to check out. One of the biggest takeaways I would say is that you do not stop taking this abruptly. Please, please, please do not stop cold turkey. Abruptly stopping any form of gabapentin can lead to worsened seizures and unpleasant withdrawal side effects. So it's best to slowly stop taking over a period of time, and your doctor will direct you on how to do this gradually. So please let them know before you try doing it yourself. Now there you go, you're now a gabapentin pro. This isn't everything there is to know about this medicine, and I'm sure your doctor will explain more details to you guys. I only hope that this was enough to point you in the right direction. I also hope that this video was insightful to you guys. The only thing I ask in return is just a simple like down below for the YouTube algorithm. It really means a lot, and if you guys would like these types of videos, let me know in the comments below. I try my best to get back to all of you guys. Thanks for sticking tuned all the way to the end, and I'll see you guys on the next one.